Okay, I have a new question, Joyce. I'm a stage 4 ER/PR positive and HER2 negative, diagnosed de novo in 2008, been on Femara letrozole since. Femara is the same as letrozole. CT scan every 6 months. I feel that I'm running in borrowed time because we all know someday it will come back. Would you suggest anything to be proactive? Thank you. ER positive, PR positive, HER2 negative breast cancer can have some indolent course sometimes, meaning it can be slow progressing or stable for a long time. It can go in the dormant stage when the doctor performs scans after scans and there is no evidence of disease. This is very good news. And it's when we have those patients, we are very glad to take care of them because we get to see them have a very normal life despite the stage 4 cancer. So this is not so unusual to continue to enjoy as normal life as possible on the treatments, same treatments for a very long time. I do want to make sure that we monitor our patients very, very closely. At the time when there was the diagnosis, just starting an aromatase inhibitor was the standard of care at that time in all postmenopausal women. About 6 years ago, adding CDK4/6 inhibitors has become the standard of care. However, in somebody who's already benefiting and having no significant progression of their cancer, I don't see a reason to change anything at this time. We have this basket of options that we like to use very wisely and carefully so we can extend the options as long as we can. So even though we have available new options, there's no reason to use them up if the current treatment is working well. Sometimes I do combine CT scans with bone scans because sometimes the combination of the two can be more accurate in detecting lesions in the bone. Also, occasionally I can do a PET scan. That can also be a test to make sure we're not missing if you have any concerns about missing something. But if clinically on the laboratory tests and the studies, there's no evidence of progression of the cancer, I would not change anything at this time.